Hello friends, welcome to the channel Dewdear Academy. In this video, I am discussing the question paper Sree Chitra Institute for Medical Science and Technology SCT Staff Nurse Examination. This is the part 5 of the question paper discussion. So here I am discussing the question number 61. A client receiving dialysis for end-stage renal disease want to quit dialysis and die. Which ethical principle supports the client right to die? Options are autonomy, self-determination, beneficence, justice. Autonomy, self-determination, beneficence and justice. So the client receiving dialysis for ESRD wants to quit the dialysis and die. So which ethical principle is supporting this client's right to die? So here the correct answer here is option A is the correct answer, that is autonomy. Autonomy is the correct answer here. So these are all coming under the ethical principles. Autonomy, self-determination, beneficence, justice. These are coming under the topic of ethical principles in foundation. Then question number 62. A physician prescribes laboratory studies for an infant of a human immunodeficiency virus positive woman to determine the presence of HIV antigen. Which laboratory test will be prescribed? A physician prescribes lab studies for an infant of a HIV positive woman to determine the presence of HIV antigen. So which lab test will be prescribed? Options are Western blot, then chest X-ray, CD4 count, P24 antigen assay. So in this the correct answer is option D, P24 antigen assay. P24 antigen assay is the correct answer here. In case of lab studies for infant of an HIV positive woman to determine the HIV antigen, the lab test that will be prescribed is P24 antigen assay. Then 63, question number 63. A nurse is caring for a child with a suspected diagnosis of rheumatic fever. Which laboratory test would assist in confirming the diagnosis? A nurse is carrying a child which is suspected diagnosis of rheumatic fever. So which lab test would assist in confirming the diagnosis? Options are white blood cell count, red blood cell count, then immunoglobulin, anti-streptolysin or titer. In case of rheumatic fever, the correct answer is option D is the correct answer, that is anti-streptolysin or titer. Anti-streptolysin or titer is helping in confirming the diagnosis of rheumatic fever. The question number 64. A client tells the nurse that his body is made of wood and is quite heavy. The nurse interprets this as options are compulsion, hallucination, depersonalization, obsession. Compulsion, hallucination, depersonalization, obsession. The question is, client tells the nurse that his body is made of wood and it is quite heavy. So this is indicating depersonalization. Depersonalization is the correct answer. So this is a question from psychiatry. If the client is telling that his body is made of wood and it is quite heavy, means that is indicating depersonalization. Then question number 65. Which of the following might increase the client's risk during ECT? Options: degenerative joint disease, insulin-dependent diabetes mellitus, recent myocardial infarction, use of multiple medications. Question is, which of the following might increase the client's risk during ECT, electroconvulsive therapy? Which of the following might increase the client's risk during ECT? Options: degenerative joint disease, insulin-dependent diabetes mellitus, recent myocardial infarction, use of multiple medications. So the answer here, correct answer here is option C, that is recent myocardial infarction. Recent myocardial infarction is the correct answer, and that will be increasing the risk during ECT. Then question number 66. A client with pregnancy-induced hypertension is hospitalized and is receiving magnesium sulfate by IV push. Before administering each dose, the nurse would assess the client's options: temperature and pulse rate, respirations and patellar reflex, blood pressure and apical pulse, urinary output relative to fluid intake. Question is, the client with pregnancy-induced hypertension is hospitalized and she is receiving magnesium sulfate by IV push. So before administering each dose, the nurse would assess the client's temperature and pulse rate, respirations and patellar reflex, blood pressure and apical pulse, urinary output relative to fluid intake. So the answer here, in case of patient receiving magnesium sulfate, it is important to note the respirations and patellar reflex. So option B is the correct answer. In case of pregnancy-induced hypertension, if the mother is receiving magnesium sulfate by IV push, it is important to note the respirations and patellar reflex. So option B is the correct answer here. Then question number 67. The word postcode describes the elements of administration in which S stands for. Options: supervision, selection, securing, staffing. The word postcode in administration, in elements of administration. So here S is indicating what? Supervision, selection, securing, staffing. So correct answer is option D, staffing. S is indicating staffing. So postcode is a very important term that is coming in elements of administration, which indicate planning, organizing, and S is indicating this staffing. Then question number 68. The best marker to diagnose thyroid related disorder is. Options are T3, T4, TSH, thyroglobulin. The best marker to diagnose thyroid related disorder is, whether it is T3, T4, TSH or thyroglobulin. So here the correct answer is option C is the correct answer, TSH. TSH is the best marker to diagnose thyroid related disorder. Then question number 69. First treatment of rupture of varicose veins at the ankle should be. Options: rest in prone position of patient, application of a tourniquet distally, application of a tourniquet proximally, direct pressure and elevation. So what is the first treatment of rupture of varicose vein at the ankle? Whether it is to give rest in prone position of the patient, application of a tourniquet distally, application of a tourniquet proximally, whether to give direct pressure and elevation. So the correct answer is give direct pressure and elevation. So option D is the correct answer. Give direct pressure and elevation. Give direct pressure and elevation. This is the first treatment of rupture of varicose veins at the ankle. Then question number 70. The commonest site of oral cancer among Indian population is. Options: tongue, floor of mouth, alveobuccal complex, lip. Which is the common site of oral cancer among Indian population? Whether it is tongue, then floor of mouth, alveobuccal complex, or whether it is the lip. So the correct answer here is option C, that is alveobuccal complex. Alveobuccal complex is the commonest site of oral cancer among Indian population. Option C is the correct answer, that is alveobuccal complex. So in this video I have included the 10 questions. Then the next video I will be including the remaining 10 questions. So thank you all of you for watching this video, and this video will be beneficial for all those job aspirants who are getting prepared for various competitive examinations.